Good afternoon, everyone, and thank you for joining us here on January 7th for our Erie County COVID-19 update. You will hear also later from Dr. Gail Burstein, and we're joined by Karen Gambino from Deaf Access Services. Before we begin the discussion regarding COVID, and we have some important information to share, I do want to talk about the events that occurred yesterday in our nation's capital. Yesterday will go down as one of the darkest days in U.S. history. The President fomented his supporters to march on Congress and take action to prevent the representatives of the people from performing their constitutional duty of confirming the 2020 election results. It was not a peaceful protest. It was a treasonous attempt by a riotous mob at a coup d'etat. Every time I have walked the hallowed halls of the Capitol, I am filled with awe thinking of the giants of our nation who have walked those same halls before me. Yesterday, those halls were stained by the seditious acts of traitors, not patriots. The genius of our democracy is we do not subject ourselves to a person, but to a set of ideals codified in our Constitution, the peaceful transfer of power being the most important one. Unfortunately, the events of yesterday were not surprising. 4 years ago, prior to President Trump's inauguration, I remember people who supported him saying, "Don't worry, what harm can he do?" Since then, we have witnessed the damage he could inflict on our nation, culminating with his continued attack on the legitimacy of the election and yesterday's terrible attack on the heart of our democracy, after the President incited them to take action. The insurrection that attempted to prevent Congress from performing its constitutional duty failed. However, the risk to our republic still exists as long as President Trump retains power and promotes his own self-serving efforts to stay in office. The Constitution has a mechanism to ensure our nation's stability through January 20th. As I called for last night, I continue to call on Vice President Pence and the Cabinet to invoke the 25th Amendment to ensure the rule of law prevails during this tumultuous time. The words of the Constitution's preamble begin, "We the people of the United States," in order to form a more perfect union. As yesterday's events proved, our nation is still seeking that more perfect union. We are a nation of laws, not mob rule. If we are ever to become that more perfect union, it requires all of us to be engaged in an educated civic discourse so that we never have days like yesterday again. Thank you. And I will certainly take questions from media afterwards with regards to the discussion I just had. And now we will move on to COVID-19. As of January 6th, 44,191 COVID-19 cases have been identified in Erie County. The 7-day positivity rate continues to increase. It is now at 7.5% as of yesterday. There were 1,297 confirmed deaths as of January 5th. We'll go into that a little bit more greater detail. And on January 5th in area hospitals, there were 540 COVID-19 patients in all Western New York hospitals, 90 of them in the ICU. In Erie County hospitals, there were 425 patients, 74 in the ICU, 50 on an airway assist. Unfortunately, another 4 people died on January 5th. And of all the patients that were hospitalized on January 5th, 35% of the patients were age 64 and under. On the screen, you will see the new cases by zip code for the week ending January 2nd, based on the positivity rate. And you will see that even though it wasn't a very large amount of cases, there were 6 cases out of 39 tests in the zip code of Lawton's. Lawton's is actually one of the smallest zip codes in Erie County. It had a positivity rate of 15.4%. And the town of Holland had a positivity rate of 15.1%. Every one you see on the screen is a positivity rate of 7.2% or above, with quite a number of them in the 10 to 11 range. And these are some of the same zip codes we've seen in the past. We see a lot of cases in the rural areas. We see a lot of cases in the suburban areas. There are cases, of course, in the urban areas, though it's really these rural areas and the suburban areas that are driving the highest percentages. And this is as of January 2nd. We are starting to see now the cases as a result of New Year's Eve parties. And it is very distressing what we're seeing. Because for yesterday, January 6th, our Department of Health has identified 852 new cases that came in. This is the highest daily total ever for Erie County. That was out of 11,268 tests reported. The daily positivity rate was 7.6%. We are going in the wrong direction. I was trying to advocate to the state to take us out of the orange zone and move us into the yellow zone for the vast majority of Erie County. As the governor has noted, if our numbers are going up and our hospital rates are going up, that's not going to happen, and we are headed in the wrong direction. Hospitalizations, this is the 2-week chart from December 23rd to January 5th. We've been in a similar position for the last couple of weeks. We haven't seen huge increases, but we still have a significant amount of beds occupied in Erie County. 75.4% of all beds in Erie County were occupied. This includes COVID and non-COVID cases. 17% of COVID hospitalizations are in the ICU room, or ICU, or intensive care units. And the intensive care unit as well as airway assist numbers have remained steady over the past 3 weeks, even though we've had a lot of deaths. So that means individuals are dying that were in the intensive care unit on an airway assist, and they're being replaced by other individuals who were either in the hospital previously or are just coming to the hospital for the first time. So that is really disconcerting. Based on a conversation I had with hospitals not that long ago, it was showing that approximately at least 15% of those who are hospitalized in the ICU units were dying. That's too high a number. And the only way we can stop that is to prevent people from getting the virus in the first place. Mortality data, as you can see, we now have data through January 5th. And unfortunately, when it comes to 2020, 1,265 Erie County residents died from COVID-19 in 2020. That's approximately 1.4 deaths per 100,000 population. And it's very sad. Those are 1,265 individuals who might be here today, who may have celebrated a Christmas, a Hanukkah, the New Year, who are no longer with us. And unfortunately, since the beginning of the new year, we've had 32 additional deaths, including one under the age of 40, one between 50 to 59, one 60 to 69, and the vast majority of the deaths were over the age of 70. I'm going to turn over to Dr. Burstein now. She's got a lot of info on vaccines and a lot of the good stuff that we're doing in Erie County. And after that, we will entertain questions from the media with regards to this and the events of yesterday.
Thank you. Good afternoon. So as a county executive said, we are going to talk about the positive things that we're doing in this COVID-19 pandemic. So first of all, the thing that we've wanted to do this whole pandemic is to give vaccines, and we are giving vaccines. We are putting shots in arms. So we are working with our Western New York Regional Hub to make sure that we have a coordinating vaccine efforts with the other Western New York counties and coordinating with the state. So just in the past 3 days, Erie County Health Department has immunized 2,539 people. So just in 3 days, we've given over 2,500 vaccines. Unfortunately, right now we are just immunizing the people who are eligible for vaccines in the group Phase 1A, and our vaccines will not be available to the general population for several months, probably not till later in the spring or the early summer. However, we are being aggressive to immunize as many people as possible as fast as we can get the vaccines from the New York State Health Department. So we are scheduling appointments for next, and they have full for this week, unfortunately. We are going to have vaccine clinics next week if we do get more vaccine from the state. Remember, this is just going to be Phase 1A, where there are a lot of people in Phase 1A, and so we're going to be in Phase 1A, probably for the rest of the month. And we are notifying those individuals through their professional networks. And so if you haven't received an email about this or notification about it, and you see that you don't really belong on the list, then you'll just have to wait. We're having a lot of people actually call the site where we are giving vaccines this week to ask for questions about how to register for an appointment. So please do not call that site. They are not making appointments. All appointments are online. So just please, if you receive an email, please use that link. And as I said, we're full for this week already. It's great that people want to get immunized, and we're getting them immunized. And we should have more slots available next week when we get more vaccine from the New York State Health Department. So people who are eligible to get immunized, so when you make your appointment online, you will get a confirmation ticket that you can either put on your phone or print out, but you have to have that available when you come to get your vaccine. You also have to bring your agency documentation, either your IG from your job or your letter that confirms that you are an employee of whatever category you meet in Phase 1A, and that you are an eligible member of the group. So if you work, say, in a healthcare provider's office, say a doctor's office, that you are, seeing patients face to face. You're not in the back when billing or anything, but you are seeing patients face to face. And so, again, please don't call the health department. Please don't call the pod where we're giving the vaccines. We are not making appointments by phone. This is all online. So I'm going to turn to another epidemic that we're struggling with in Erie County, unfortunately. So I know that we have, all our eyes, we're all paying attention to our COVID-19 pandemic. However, we still have so many people in our community that are struggling with opioid use disorder. And so here, this slide is looking at our opioid-related deaths starting from 2012. I'm going to what we have confirmed so far in 2020. And so you can see that we were really successful, that in the latter half of this decade, we made some great gains, and we saw consistent decreases of number of opioid-related overdose deaths. Unfortunately, this year in 2020, we are seeing an increase. So even though there are still 68 cases that we have to confirm and get through the tox screens, we still have 194 individuals who've succumbed, who have died from an opioid-related overdose. And that is a larger number than last year of 156, and it's even a larger number than the prior year of 191. So, we are still struggling. Our community still is in a crisis with opioid use disorder and opioid overdoses. So, again, as Erie County responds to COVID-19, we are responding to our opioid overdose crisis. So, it's not the same as it was before 2020. We're in a different set of circumstances. However, we are adapting to that circumstances, and we're trying to be as aggressive as possible to getting people the help that they need. So we are still, giving, Narcan training, multiple different ways. So we're giving Narcan training and Narcan kits, in addition to other health education like sexual health information, condoms, and live. We're going to be doing it on starting today, actually Thursday, from 4 to 7. So we'll be there every Thursday at St. John Candy parking lot. We'll be there with our Live Well Erie van, so you'll recognize that's who we are. We're also going to be doing this work, outreach on Tuesdays. Again, every Tuesday from 4 to 7 on the corner of Grant and Ferry on the west side. So we are offering these socially distanced in-person services. And remember, everybody has to wear a mask. If you are in isolation and quarantine, please do not come to these sites. Also, we're virtual ways that we're reaching out to people. So if you need Narcan and you don't want to come to any of these in-person sites, we completely respect that. And so you can text us for Narcan. So you text the number 716-225-5473, and all we need to know is how we can get you the Narcan, where we need to deliver it to, and we will get you that Narcan. Also, we know that many people are struggling with opioid use disorder and they're at home. They're home alone, they're either working from home, or unfortunately many people have lost their jobs and they're sitting unemployed with really nothing to do and using it home. So if you are physically alone, you don't have to be alone when you use. So there is an app called Never Use Alone, or you can call this number 800-484-3731 and let them know when you're going to use, and then let them know how you want to be contacted 5 minutes after you use, either a call or a text. And so they will call you or text you 5 minutes after you start using, and if you do not respond, they will call 911. So even though you will be using alone, you will not be alone. Somebody will be checking on you. Also, we're doing virtual Narcan trainings. We're doing them multiple times a day, multiple days of the week. It's easier to organize a virtual training now. It's not an event at a site. So you can just go to our erie.gov/opioid trainings website and register a training. Everybody who completes a training gets a free Narcan kit. So lots of incentive. Also, we still have our 24/7 crisis services addiction hotline at 716-831-7007. So that gives people great information. It also can get you your first appointment with a substance use disorder treatment provider, and you can start on your path to recovery with medication-assisted treatment that is effective. Also, we still have Buffalo Matters working in the emergency department. And now we have virtual Buffalo Matters, so people can access Buffalo Matters by going to the emergency department virtually. All the emergency departments have virtual access to get services, and that includes Buffalo Matters. So we highly suggest that if you want to start on medication-assisted treatment where you're struggling with opioid use disorder, you don't want to go in person to the ED, you don't want to call the hotline, you don't want to go to our Narcan trainings, that is fine. You can go to any of the emergency departments in Erie County and click on a virtual appointment, and you can get through Buffalo Matters your prescription for low-dose buprenorphine, or Suboxone is the trade name. You can get a dose of Narcan. You can get linked up with a peer if you want to, and you can get your first appointment with a long-term treatment provider and start your way onto the road with recovery with medication-assisted treatment, which is effective. Also, if people know that they have people in their lives struggling with opioid use disorder or any substance use disorder, please call on them, please check on them. People many times are using because they just are so depressed, they're so discouraged, they're alone. We know isolation, fosters, depression and hopelessness and helplessness. So please call friends, families, and neighbors and check on them. Also, a celebration. We are all so excited for our game day with the Bills, so I just want to go Bills. However, we want people to be healthy while they're watching the Bills. So remember, the safest way to watch is to watch at home with the people that you're already living in your household. And we know that some restaurants are offering opportunities to watch outside and outdoor dining. Remember that the dining at a restaurant right now, since we are in the orange zone, has to be outside and limited to 4 tables. So it has to be a structure that is open for at least 2 walls. So if restaurants have an igloo or restaurants have a tent that is fully enclosed in four walls, that is not allowed per the New York State Empire State Development. And we are going to have sanitarians out on game day and looking for those and enforcing these restrictions. So we want people to have fun. We want people to be safe, and we don't want anybody to go turn on the TV for a Bills game and then or go to a restaurant for a Bills game and walk out with a COVID infection. So we want everybody to have fun, root the Bills, go Bills, and stay safe and healthy. And now I'm going to turn it over to the county executive to answer questions.
Thank you, Dr. Burstein. We will begin with the B News. Ethan Powers. Are you there, Ethan?
Hey, Mark. Thanks for taking questions today. Obviously, a lot has happened in the past 24 hours. We've seen congressional leaders and some business groups calling for the vice president to invoke that 25th Amendment, rumors of a second set of articles of impeachment being drafted, litany of White House officials resigning. These tumultuous events are occurring as some parts of the nation, including your remarks, including Erie County, are seeing some of the worst virus numbers yet. My question is, does this ambiguity and lack of consistency at the federal level affect in any way the effectiveness of localities like Erie County to combat the virus as they try to ramp up vaccination efforts?
Well, the one thing we have seen is the lack of distribution on the national level that was fully expected by the federal government of vaccines. The governor has noted that recently the good job that ECMC has done in the distribution of its vaccines once received, as well as now Kaleida Health. I will note that Erie County went through its first allotment in 2 days, and we went 100%. What we got was 1,500 in, and they were gone in 2 days. But we could do a lot more. And what we really need is the federal government to step up to the plate and ensure that more vaccine is delivered across the country. So yes, the incidences that you saw yesterday are concerning, not just on an attack on our democracy, but on our ability to respond to one of the greatest national threats that this country has seen in decades, and that is the coronavirus pandemic. I am very concerned. I was exceptionally saddened watching what happened yesterday. I've pledged as both an attorney to uphold and defend the Constitution of the United States, as well as an elected official to uphold and defend the Constitution of the United States. And yesterday was an attack on the Constitution of the United States by Americans, not foreign citizens, by Americans who are enticed and encouraged to go down and show their anger to the Capitol by the president. And that just takes away from everything else that we need to deal with, which is somehow trying to bring this country together with a new president coming in on January 20th while we're in the middle of a global pandemic. And I think we all agree the federal government could have done a much better job in addressing the coronavirus pandemic for the last year. That's passed. What we need now is a federal government that's active and engaged with regards to the vaccine delivery to the states and localities. And I know we're going to get that once we have a new administration, but over the next 13 days, we have a president who doesn't seem interested in doing anything other than calling for the overturning of the election. We need someone in there who's going to do a good job, someone who's going to care about the citizens of the United States, not himself. That's why I've called for the invocation of the 25th Amendment. I trust Vice President Mike Pence to do the right thing for our community, our state, our country, even if it's only for 13 or 12 days. I trust him to do a much better job than the current president. Mike Baggerman, WBEN.
Hey, Mark, are you expecting a massive spike in cases as a result of home gatherings for the Bills game this weekend? And if so, is there a way to quantify how much you think the spike is going to be?
Well, I can't really quantify it, but yes, we are expecting an increase. Actually, we're expecting an increase in the next couple of days, just alone with regards to the individuals who are being tested to attend the football game. As we all know, the Bills and the state have agreed to a system in which bioreference laboratories will be testing individuals. They did yesterday, about 5,000. They'll be doing the remainder today. The individuals who were tested yesterday, that 5,000 of them, not all of them are Erie County residents, but I'm fairly confident a good portion of them are. And we're expecting a big bump up with the number of tests that we're perform that we're going to be getting results of in the next 24 hours, and with it also positive cases. When it comes to the football game, if people do what they've been doing all along during the regular season, and that's watching the game at home with their family and not going to mass gatherings, I think we'll be okay. We've shown that we can do it. We went through a 16-game season over 17 weeks in which it can be done. So I think it's possible. We have seen an increase lately associated with the holidays, with small gatherings, with travel, with individuals who, for whatever reason, caught the illness. But we know if you follow the basic tenets of staying at home and being with your immediate family, you can do it safely. We are worried, but there's no way to quantify it, though I will note we are going to probably see a bump up in cases alone just from the tests associated with those who agreed to purchase tickets for the football game. Because if you look at our numbers, we know always there are asymptomatic people who are testing positive. They are doing the best test, the PCR test. It is very good at identifying individuals who are asymptomatic that have COVID-19. So I'm fairly confident there are people who took the test yesterday that are feeling dandy today but have COVID-19. And we'll learn about that in the next 24 to 36 hours. WBFO, Michael Desmond.
Yeah, do you any idea how many flunked yesterday?
I don't know. No, we have not received the data yet. My understanding is there were approximately 5,000 people that were tested yesterday at the Buffalo Bills site. The swabs were taken to New Jersey. They were not processed locally. They were taken to New Jersey. Those tests are probably being completed as we speak. Those individuals, once those tests are confirmed, will receive information or have received information on the Bills and how to check their results. So some of those people are going to receive it tonight. BioReference then has to transfer those results to New York State. It's possible we won't see that. Well, we probably won't see it in the earliest till tomorrow, and we may not even get the information until Saturday. So we won't know about who failed the test until possibly the game time. Those individuals will have known beforehand. And I want to remind everybody, the season ticket holders are not just Erie County residents. So while there are about 6,400 individuals who could purchase seats, they come from all over Western New York, other parts of New York State. There are no Canadians that were eligible because they can't cross the bridge. So what I have asked the Bills, and they have pledged to provide afterwards the total amount of people who took the test and the total amount who failed. So we know, based on a percentage, of how many of those individuals in total actually had COVID-19.
Mark, following up, people who are notified if they flunk, are they health vector problems?
If people failed, they have to quarantine. They actually have to isolate. If they failed, they have to do what we've always recommended to an individual who's failed or tested positive on a COVID-19 test, and they have to isolate. So they can't go to the game. They're certainly not going to be allowed in, but they have to isolate, and the other members of their family have to quarantine because they've now been around an individual who tested positive for COVID-19. So anybody who fails will have to isolate, and we will get the names of those individuals who live in Erie County who failed, just like the Niagara County Health Department will receive the individuals who are season ticket holders and took a test that live in Niagara County and so on for the rest of Western New York. So we won't know about that for a few days, but those individuals, once they get that positive result, have to isolate. The Buffalo News, Aaron Bessaker and Sandra Tan.
Hi, Mark. I was wondering, can you offer any update on the county's preparations for Saturday out at the stadium?
We are going about our business as normal for a football game. Abbott Road will be closed, as it is during a football game when the fans are there. We will have our individuals from the Department of Homeland Security and Emergency Services, our Emergency Medical Services Division of Department of Health, as well as the Public Works Department, and of course the Sheriff's Office on hand. We will probably not have the full crew that you normally would see with 70,000 people there, but we do have to be prepared because there are going to be thousands in the stadium, and as such we will have not a skeleton crew, but a little less crew than we would have during a normal game, and certainly more than we had when there were no fans in the stadium. But it's kind of business as usual, just a little different style. But Abbott Road will be closed in front of the stadium. So those who are pulling into the lots will have to pull in through where they normally would pull in, because as most people know, Abbott Road is closed in the immediate vicinity in front of the football stadium before the game starts.
Mark, it's Sandy Tan at the Buffalo News. Can you elaborate a little bit more on your death numbers? Because I just want to make sure we're understanding this correctly. Based on the death numbers you shared, that means that nearly 100 people, you learned that there have been at least another 100, nearly 100 people who died in the last month?
Yes. It was a little over 90, I believe. Might have been 92. I'm pulling it off the top of my head, but we were averaging more than 10 a day. When you include the individuals who died in the hospital and those who died in a nursing home or died in another setting, such as their home. It's been bad lately when it comes to deaths. That's why I want people to know that this is serious. Is this
attributable to the holidays, or do you have any indication as to what's led to this high number of deaths?
Well, once you get increasing number of cases, you invariably have increasing hospitalizations. And then the last indicator, the lagging indicator, so to speak, as they would say in economic terms, is deaths. Because that's the thing that happens the last. It's very, very sad to see that in the month of December there were 385 individuals who died in Erie County, which is 99 more people than who died in the previous highest month, which was April. And those death numbers continue. We actually, as I said, had a little lower death number in the hospital for the 5th, but we've had some, let me see if I can pull it up here. Yeah, here. You'll see the dates since December. I think the last recorded day we really had was December 29th, and you'll see on December 29th, we may have announced it on December 29th, but there were 11 people who died in a hospital on December 29th, 9 on the 30th, 16 who died on the 31st. It's been bad, and the average age is 80, but it just goes to show that as we move along, just because we are in a situation where maybe we're doing better than another part of the state, that doesn't mean we're not susceptible to the cases as well as the hospitalizations and then the deaths. It's very sad. I'm like a lot of other people who are just shaking their head when they click on their Facebook page and they see the news feed from people that they know, and they're all commenting about the death of a loved one. I've had a lot of people who reached out to me through the last few months saying, I really didn't think COVID was much of anything, and now I've lost a family member. I know 2 people who've died, and yeah, I'm taking it a lot more serious than I was. It's sad, and all we can do to prevent those higher death numbers, once again, is to see the overall cases go down. Unfortunately, as I reported, the number of cases that came in yesterday were the highest on any day that we've ever reported. Spectrum News, is anyone on from Spectrum? If not, we'll go to WGRZ and Dave McKinley. David?
Yes, hello? Hello?
Hi, David. Go ahead.
Yeah, okay, great. About early on in your remarks today, you had talked a little bit about how you have addressed with the state, possibly taking it out of an orange zone, and that you had also indicated that with the numbers going up and going the wrong way, that's unlikely to happen. But I'm curious to know if ever in your conversations or even your lobbying about this with state officials, do you ever point out to them that just about every area of the state qualifies to be in an orange or even a red zone, and yet here we are perpetually like a pumpkin?
The answer to that is yes. I've compared our other parts of Western New York as compared to other parts of New York State, and for the time being, they've indicated that they think we should stay in the orange zone. They have taken my statements to the highest levels. I mean, I've talked to Lieutenant Governor about this multiple times. I think she feels a very similar situation as us. That it's a little unfair to be treating Erie County differently than some of the other parts of the state that actually have worse numbers. I know I'm talking to Adam Bello the Monroe County executive. He's got worse numbers than us. They still have a good portion of Monroe County in an orange zone. And it's something that we can advocate on behalf of, but in the end, it's the New York State Department of Health in conjunction with Governor Cuomo that makes the decision. And until they say, yes, you can go back to a yellow, we stay in an orange. I'd hoped we would go down to an orange, and I advocated for it in the last week, but then we had the most recent numbers, which indicated not only our positivity rate going up, but we've seen that big increase in, not big increase, but an increase in hospitalizations again, and that kind of, that hurt us.
Yeah, and just quickly for Dr. Burstein, is the county just reserving its testing to those who are likely exposures and who have symptoms? Remember a while back we kind of go into that route, just testing those instead of just everybody. Is that still the case now?
Right, we didn't include a testing slide because nothing has changed. So we are only testing people who are close contacts, so they should be in quarantine. So that means that if you think you want to get a vaccine and you're eligible, oops, thanks. So that means, so if you're in quarantine, you should only be going out to get testing or to be seen by a healthcare provider for your symptoms. If you think you're eligible to get a vaccine, if you're in quarantine, please do not come to the vaccine site. We don't want to expose our vaccinators. So yeah, we are testing people who are close contacts in quarantine, and we are also testing people who are symptomatic. So again, people can call 858-2929 to schedule an appointment. Today, our call center was, actually the phones weren't working. They are back up, and so I hope people can be patient, and if you call this afternoon, hopefully you will be able to get through. Thanks.
Thank you. We'll now move on to WIVB-TV. Chris Orvatis.
Hey, Mark, I hope I connect.
Yeah, I can hear you. Go ahead.
One of our local representatives.
Can you speak up or speak a little closer to the phone? Just losing you. You're going in and out.
Sorry. I think it's a bad internet connection. I apologize. Dozens of Republicans still voted to affect to state electoral votes, including one of our local representatives. Review on that in general, and specific to our local representatives. Where do you stand on that? Did that and represents part of the county?
Well, as I noted yesterday, after Congressman Jacobs announced that he was going to vote to sustain the objections, that it was unconscionable. I've known Chris Jacobs for a long time, and I was shocked that he would do that, because it's been proven over and over and over in every court of law that there's no merit to the accusations that have been made by the president and Rudy Giuliani attacking the validity and the veracity of our election system. And what yesterday was I guess, an effort to rile the base even more, to say, oh, we think there were problems and we need to object to those. So I was shocked that Representative Jacobs did it, because he represents a region where I thought that the vast majority of us believe in facts, believe in truth, believe in the rule of law. I was surprised, and that's why I called him out for it before the rioting and the takeover of the Capitol began. I mean, it's quite clear that what has happened is there's a percentage of our population that doesn't believe the truth anymore. And unfortunately, one of our local congressional representatives sided with them. I texted yesterday Congressman Tom Reed, and I thanked him for doing the right thing. He doesn't represent Erie County, but he represents Chautauqua, Cattaraugus, Allegheny. I've communicated and dealt with Congressman Reed on a number of occasions before. We don't always agree on policy, but we have always had very cordial conversations as we try to do what's best for Western New York. Congressman Reed did the right thing, did the honorable thing, did the thing that the Constitution demands of him, which is, I'm going to vote to support the electors that were provided by all of the states, not vote in favor of overturning the electors from what were considered to be these key states that the president keeps on saying was stolen from him. There is no evidence that it was stolen from him. We need to realize that just because you lose an election doesn't mean it was stolen. I've worked on plenty of campaigns in the past where the person I wanted to win lost, including presidential races. And while I may have been upset that my candidate lost, I didn't say we need to storm the Capitol to overturn the election. And if I was a congressional representative at that time and I was a Democrat and I had to vote, even though I thought that it was unfortunate that my favored candidate lost, and I was going to vote to overturn those electors, I wouldn't have done it. And what Congressman Jacobs did yesterday was not represent the will, not only the will of the people, but do his duty. As I've said, we all swear to uphold the Constitution of the United States. He did not do his duty to uphold the Constitution of the United States. And as was noted today in the Buffalo News, he did the cowardly thing when they called him in their lead editorial a coward. It's as simple as that. And that's why I criticized him yesterday, and I continue to criticize him today. We can have a disagreement on policy and do it in such a manner where we're not ripping at the fabric of our democracy. That's what yesterday was. It was an attempt by those who voted to sustain the objections, to rip the fabric of our democracy at the same time, or approximately the same time, I should say. People were gathering en masse in the Capitol to rip down the doors and to rip once again at the fabric, at the heart of our democracy, our Capitol. It was unconscionable, and no matter what Representative Jacobs does for the rest of his career or his life, he will always be remembered for that terrible vote. WKBW TV, is there anyone else on?
Yeah, hi, Mark. It's Ashley Rope here. Can you hear me okay?
I can hear you, Ashley. Go ahead.
Okay. Piggybacking off of what Dave McKinley was talking about, if we look at the metrics, really, Erie County, Western New York, much of the state should be in at least the orange zone, but actually the red zone as well. And yet the state is showing no interest in going in that direction for a full shutdown. Yet we're seeing it happening in England, we're seeing it happening in Ontario, we're seeing it happening in other places. Is the fact that we are not shutting down more directly linked to the lack of stimulus, federal stimulus?
I don't think so. If you know, remember, Ashley, the state did change the zone determinations to include the hospitality rate, the hospital rate, and those, and how many beds we have available in the hospital. And they said once you hit that 15% or less available beds, then you would go into a red zone. We've never hit that. And based on their new description of where we are, we're under 30% available beds in Erie County. We theoretically do qualify under their orange zone, as do a lot of other places in New York State. The one thing that I've said, I don't have as much of a problem if they say those are the numbers and they stick with them, as in, well, if we are at this and someone else is at the same thing, but they're not in an orange, or they may not even be in a yellow, how is that fair? So those are part of the arguments I've made, and that's why I advocated for going back to a yellow. But once again, our positivity rate went up, our hospitalization rate went up, and hopefully we can reduce both of those so that we are not having this conversation about being in the orange zone anymore.
Just a quick follow-up, and I know you don't like to hypothesize, but if I can just ask, we've now seen that the Democrats have taken the Senate. If there is a greater federal stimulus package that allows people to be supported while they are not working, while they are furloughed or laid off, would you advocate for a full shutdown?
I don't think we're in a position, and once again, it's a hypothetical, but I don't think we're in a position where we'd have to have a full shutdown. If I'm advocating to go from an orange zone to a yellow, then it doesn't make sense for me to advocating for the equivalent of a red. But I understand the premise of your question. I don't know what, if anything, we're going to get from the federal government anytime soon. I think it's very likely now that an additional stimulus round will be approved once the Biden administration has taken effect, now that the Democrats will control the Senate. And our own senior senator, Chuck Schumer, will be the majority leader, which is very important for New York. It brings New York a lot of power. So I think we will get additional round of stimulus, but I would not anticipate it for weeks to potentially months away. And I know it's just one of the discussions that the incoming Biden administration will be having. Yesterday, I was on a conference call before everything went kaplooey, so to speak, with the incoming Secretary of Treasury, incoming Secretary of Transportation, former South Bend Mayor Pete Buttigieg, in which we talked about the need for infrastructure dollars in key projects. One of those that I highlighted was the expansion of the Metro Rail from its ending at the University of Buffalo South Campus through the new University of Buffalo North Campus into parts of Amherst, and how important this is for transportation and our issues, as well as a sustainable climate, because we know one of the primary drivers with regards to greenhouse gas emissions in our community, as well as the country, is emissions from transportation, from vehicles and from trucks. He was very receptive, and I do believe that the Biden administration is going to move ahead with an infrastructure bill as well. That's not to say that they're going to put $1.5 billion in there for the Metro Rail project, but I do think he was very receptive to saying that these are the type of projects that the Biden administration will be looking at, which I will remind everybody is not just good for our transportation and our greenhouse gas emissions, it's also good for jobs, because thousands of people will be put to work on that project from the start to the finish, and a lot of local businesses will benefit from it. So we want to be able to put people to work, and we want to be able to move these projects forward that create a better, stronger community for all. Okay, B News, Ethan Powers, do you have more questions?
I do, Mark, thanks. Question for Dr. Burstein. Doctor, earlier this week, Governor Cuomo had mentioned that a case of the new variant of COVID-19 had been discovered in Saratoga Springs, and that it was likely a case of community spread. And we've seen health experts in the past few weeks express some concern that there's a lack of infrastructure that exists currently to track genetic variations of the virus. I was wondering if you know whether that variant has yet arrived in Erie County, and whether the County Department of Health has the tools to track it when it does arrive.
Well, I will turn over to Dr. Burstein to answer the vast majority of it, but it is something we are working on in conjunction with the University of Buffalo School of Medicine.
Thank you. That's a great question. We are all concerned about getting that variant of COVID-19, into our community. As the county executive mentioned, we are working with UB with their genetics people, and they are going to do genetic sequencing on specimens that we've had test positive. So we're going to give them our most recent specimens that tested positive. Also, we're going to be working with the hospitals for them to send UB the their positive specimens to do genetic sequencing on. So hopefully we'll have a better track of better idea of what type of strains that we are seeing in our community. But that that is a concern. Fortunately with this virus, we think that the vaccine effectiveness will not be affected, because the vaccine will help our body create antibodies to multiple parts of the spike protein, not just the one part that gets changed by this genetic variant. So we still want people to get immunized, because we believe right now that this immunization, this vaccine, will still be effective, and we have the tools now to create a slightly different vaccine with different strains, just like we do with the flu vaccine, if that need ever arises. So we will know more, hopefully in the near future. We will be tracking.
Thank you. WBEN, Michael, do you have any more questions? If not, Michael from WBFO.
Yeah, Mark, the other day you talked about how you weren't getting nursing home figures for patients or staff. Question A, are you getting it? B, it's probably a big issue for people of color because staff and so.
We have just started to receive it from New York State. Remember, New York State doesn't do the tests. It's actually the federal government who's been working with Walgreens and CVS to do the tests. We just started getting the numbers in. Truthfully, the first set of data that we have is from the most recent day, which is January 5th. We haven't really had a good opportunity to go through and drill through it as much as we'd like. So we will do that in the future. Was on a conference call just before this with Dr. Howard Zucker and Larry Schwartz, the governor's vaccine czar, as we were talking about a number of things, including nursing homes. Their goal is to get every one of the nursing homes to have their first round of vaccinations for their residents by the end of next week. It sounds like a good portion of them will be completed by Monday, but we know that there's quite a few percentage-wise. It's not like there's 20% left that need to be done. There's still probably about 50% or so, it appears, that have not had vaccines delivered to those nursing homes yet. But if New York State does what they say they're going to do, they're supposed to have gotten, at least offered the opportunity to administer the first dose by the end of next week. And that would be really good because we want those individuals who are most at risk to get the vaccine, the first dose, and then, of course, the second dose, 3 to 4 weeks, depending if they had the Pfizer or the Moderna vaccine later. Buffalo News, any more questions?
Yes, Mark, thanks. So just to follow up on that, you had expressed on Monday concerns about the fact that not only do you not know which nursing homes have been vaccinated, but also you didn't even have an overall figure for how many people in Erie County were being vaccinated. Is that information, are you receiving that information now? Is it forthcoming? And I'm also interested in your overall assessment of how the vaccine rollout in Western New York overall has gone this past week.
We don't have a daily update. Earlier this week, we got an update, which would have been Monday or maybe Tuesday. Tuesday, I should say, not Monday. Tuesday, in which the Western New York Vaccine Hub announced that there were a little over 18,000 who had been vaccinated. And of course, we vaccinated since then another 1,600 at least since that date. So we're probably around 20,000 individuals at least who've been vaccinated in Erie County as of the moment I'm speaking. I should say not Erie County, Western New York. I don't want to say Erie County because that's a different number. The state has indicated to us that they would provide us an update on a weekly basis to the number of individual or vaccines that have been provided to our local institutions, such as the federal health care qualified centers, as well as the hospitals and the county. And so we'll know exactly how many vaccines have been provided, and we'll also know how many have been administered. So then we'll at least know, okay, a number of doses. Now what's going to get a little tricky as we start getting into the near future is we're going to get a number of doses, but we won't always necessarily know if that's the first or second dose. So it doesn't necessarily mean if we say that there's 75,000 doses that have been administered, that at that point it's 75,000 people. Because once you start getting in the second dose, then of course you're going to have less people who've received the vaccine than the total number of doses that have been administered. But we did get a commitment from Larry Schwartz and Howard Zucker about an hour and a half ago that they would provide us updated information, at least on a weekly basis, on the total number of vaccine doses that were provided to the county and how many were administered. Spectrum News? Yes, no?
Hey, Mark, Mike Magazine here. I did have another question.
Oh.
My mic was muted still.
Okay, Michael, go ahead.
Thanks. I appreciate it. So this is another follow-up to the orange zone conversation you were having earlier about how Erie County compares to other counties. I'm just curious, would you and the county entertain the idea of suing New York State in the way that we saw the gyms do and in the way that the restaurants are currently doing? We
are a subdivision of New York State. The county of Erie only exists because New York State says it can. The rule, I know because I'm an attorney and I've seen this before, when counties try to sue states, they usually end up being on the losing end when it comes to a matter such as this, because the New York State Constitution designate the power to make this determination to the governor as well as to the Department of Health. Then they designate additional powers down to us. We do not exist but for New York State, so that is not a lawsuit that I would entertain, because it would be a waste of money and time. Dave McKinley, Channel 2. If not, Chris Orvadas, Channel 4.
Yes, one more, Mark. There was a report this afternoon that the Bills are close to nailing down a sponsor stadium and a bill to county.
Chris, you're going out. All I heard was Bills will nail, and then it died.
I'll try one more time. There was a report that the Bills are close to having a naming rights sponsor for the stadium. Do you have any insight on that?
I'm just not going to talk about that at this moment. The county certainly has an opportunity to review a potential name that would be put on the stadium and object to it if it's such a name that would be objectionable to our community. But I'm not going to talk about the particulars, and if there is a stadium naming rights coming soon, I'm certain the Bills will announce it. And final question goes to Ashley Rowe, Channel 7. Not there? Okay. Well, I want to thank the members of the media for your questions. We are going to go to a different system next week. We will be holding one conference on Tuesdays at 2 o'clock, so it's Tuesdays at 2. Should make it easy to remember. So we will see everybody next Tuesday. We certainly hope for a big Bills victory this weekend. They certainly have a great team. It's the best Buffalo Bills team I can remember, and I remember the Super Bowl years. These guys are good. And I'm going to be cheering on the Bills from my own home. I wish everyone to be safe and well. And as I started off today, when we talk about our country and what's happening in our country, we work and live under a system with a rule of law. And the Constitution and the laws that are based off of it are really everything that we need as a little issue in the background, but everything that we do is in relation to the Constitution that was adopted by our country more than 200 years ago, as amended since then. Mobs don't rule our country, laws do. And we, the people of the United States, have to have an informed citizenry and understand that just because you read something on Facebook doesn't mean it's true. And just because someone's disappointed with the results of an election doesn't mean it's true. It was repeated over and over and over in every lawsuit that the Trump administration filed that this was a free and fair election and it was not stolen. I'm very disappointed in our members of Congress and the Senate that voted to object to the electors from the states where Joe Biden won in a close election. I was not pleased when Donald Trump was elected, but I said I will stand as an American to do our best to create a better country for all. The last 4 years have not been good, at least in my eyes. And yesterday was one of the most horrible days that we've ever seen in our country. And the only other day I can remember that was worse than that, of course, was September 11th during my lifetime. Let us work together to create a stronger, better union, a more perfect union, in which we understand that we resolve our differences through laws. We resolve our differences through debate. We do not resolve our differences through mob rule. And if we do that, and we go back to the principles that make up our country, a republic founded on laws, we will all be better for it. Thank you. Take care. Be safe. And go Bills.